Thank you, Senator Moran. Thank you for all of you for being here. And I've got two questions, but Dr. Stone, I think you know the first question is going to be concerning the VA deaths. We have over 11 murders at the VA hospital in Clarksburg, West Virginia. It's been a year and a half, and maybe you can update me a little bit. I get calls every day still yet from families. And I know you were kind enough to come in and we talked about it, and I appreciate that. But if you have any new updated messages or information I can give to the families in West Virginia, I'd appreciate it.
Senator Manchin, you and I share our abhorrence of what occurred here. And I appreciate the time you gave me in your office to have a discussion of this. I cannot give you additional information.
Time-wise, there's nothing.
I am at I'm subject to the same restrictions that you are.
Sure.
I meet with the IG every 2 weeks, and this is all in the hands of the
I've heard the U.S.
Department
Attorney,
of Justice.
the U.S. Attorney, the one who's on the case, has left, and there's another.
I am not aware of that.
You're not sure?
I am not aware of that. I can also tell you that I find out most through either the plaintiff's attorney or the media of what's going on here.
Well,
What I can assure you is that we believe that this is a safe site for veterans to receive care. You and I had that discussion. Right. We believe it is a safe site. We have believed that we have discharged the employee that was involved in this, and we look forward to resolution. But the continuing pain in this community is intolerable.
It's just unbelievable. If for the families who might have lost a loved one during that period of time that's in question, and if that person has died, they still believe it could be attributed to the care they were getting. And it's just very hard. And a year and a half, you have to admit to yourself, no family should go through that. So I'm not here chastising. I'm basically saying that the corrections that you tell me have been made, I have not had complaints since then from the patients and from our veterans, and I appreciate that. But I just don't have answers, and my heart bleeds for the families I just don't have answers for.
Senator, I appreciate the leadership you've shown in this and the manner in which you've handled it, and appreciate the time you've given me in discussing it, honestly.
Please, we'll talk further private.
Thank you, sir.
Okay, as far as on the Mission Act, sir, I have my doubts about Mission Act. I've got to be honest with all of you. I thought it was a backdoor to privatizing the VA, and I'm very, very much concerned about that. I'm on high alert, if you will. I've got 112 jobs unfilled in the VA in West Virginia, in my four VA hospitals. And some of those are in the most critical care. And to outsource that, we're not assured in rural areas that they're going to get the care outside. A veteran wants to get care in a veteran hospital. They feel secured there. They feel good. People understand their concerns, their needs, and where they come from. So my concern has been basically of not staffing and the specialties that we need, and also the care that we can give. I'll give you an example. We did there was outside immune work done, and we could do it inside if we had the basically necessary equipment that it took for the investment. I think you and I talked about that. They were able to do it for about 1/3 of the price and do it much quicker. So I know the veterans hospitals in my area are capable of doing this work, and the veterans are much satisfied with it. But I also understand, and I appreciate the intent of Mission was, if you don't have it, shouldn't a veteran have the opportunity to have the best care? And I still feel very strongly. I'm just concerned that we're abdicating our responsibility.
Let's talk just then a little bit about what we're sending out. 90% of the increase in consultations that are going out to the community are specialty care. Mm-hmm. We are not seeing an increase.
I don't mean to interrupt you because I know our time's limited, but on that, do we have a good review process of the doctor who evaluates? As I'm understanding, if I'm a veteran, I come into the VA center, they evaluate me and decide where the best care would be. Is there anyone evaluating that evaluation doctor or that process is accurate?
Yes, Senator. And actually, this is an area of intense focus for us right now. As we have briefed committee staff, we are pursuing what we're terming our referral coordination initiative. This is modernizing the way we process referrals, modernizing the experience the veteran has, and as clinicians sitting up here, I think we all understand walking out of a visit and waiting for the phone call about when that next step in care will happen. The uncertainty of that. We're changing that and bringing ourselves in line with industry best practice, and instead having a referral coordination team take care of that veteran immediately. Do today's work today, as is a best practice. Pass on the uncertainty and instead give the veteran certainty about when that care will happen and what their next step will be.
We'd love to give you the input we're receiving because we're not getting those same types of reports that you might, and we'll give you the concerns that we have of how they've been evaluated and how they've been basically passed on.
Glad to hear that, Senator.
And it might be of help. I hope it does.
We're confident, and we are actually very encouraged to hear that when most veterans are interacting with the new initiative, our referral coordination teams, that they are telling us that they want to be with VA, that they want to stay with us.
They tell me that all the
and have
time.
that
I just want to
continuity.
reiterate to you all, I want to make sure we're doing everything we can to give the service within the VA system.
Absolutely.
And this should not be a privatization move at all. No way, shape, or form.
Absolutely. And glad to discuss further, Senator.
Thank you. Thank you.